Go.
Good afternoon, my name is Anna Marie and I'm your trainer for today. We're just going to go through the basic first aid and CPR. We're just going to go over our fundamentals, which is our doctor's ABCs, and also the use of an AED. So first thing for our doctor's ABCs is danger. So what we want to look out for is anything that's going to cause us harm to ourselves and also harm to the patient and bystanders. There could be electricity, so we need to turn off at the main supplies. It could be traffic that may be managed, need to be managed. Fire, fuel, and also people. People can also be dangerous when you're using AED. Second, we need to check for response. One way we can check for response is yell out the person's name. So this is Harry who's collapsed in the hallway. Harry, can you hear me? Harry's not responding by me talking to him. Second, we're going to just tap him. Harry, cause a bit of pain on the collarbone and squeeze the trapeze. If he's not responding, we need to call for help. One way we can call for help or send for help is get someone else to call for help. So can you call an ambulance and get me an AED, or get your own cell phone, put it in front of you on the floor, turn it on speaker and call 000. They will talk you through how to do CPR and also keep you in rhythm. Once we've called for help, we're going to check the airway. We're not going to go straight into the head tilt chin lift because that can cause potential blockage if there's an object just sitting in the mouth. So what we're going to do is just look inside the mouth, see if there's anything in there. If there is, we're going to roll them over into the recovery position and we're going to scoop it out. We're going to roll them back. We're just going to check inside the mouth again to see if there's anything else in there. Once we've confirmed the mouth is clear, we're going to open the airway. So we're going to head tilt chin lift. And then we're going to look, listen, feel. So what we're going to do is look down the chest for any rise and fall, listen and feel for any breaths or any noises. One breath every 10 to 20 seconds is not classed as normal breathing, that's agonal breathing. That is the brain's last chance of trying to fire off. So it looks like this. We're going to count to 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. He's not breathing, so we need to start CPR. For CPR, we need to have a rate from 100 to 120 beats per minute and a depth of 1/3 of the chest. We're also going to do a ratio of 30 compressions to 2 breaths. So with placement of your hands, you're going to underneath the armpit and on top of the sternum. So we're going to push down to 1/3 of the depth. Then we're going to allow full recoil of the chest. What we're actually trying to do is we're pushing the blood out of the heart, and then we're recoiling back in to allow the heart to preload. So we're going to do 30 compressions. 28, 29, 30. When we come to 2 breaths, we're going to use a barrier, which is a face mask. We're going to pinch the nose and pull the head back. This will allow the airway to open. We're also going to create seal to open the mouth. I'm going to do 2 breaths. 1, 2. Then we're going to go back into 30 compressions. 1, 2. Yeah. And then 2 breaths. If we have an AED or an AED comes to us, we want to place that on as well. If we have a second person, get them to place the AED on while you're doing CPR or following the pictures. So one underneath the left breast and one on the left shoulder. What you need to watch out for is any pacemakers that are on the right shoulder or any external amount of hair. You'll continue doing CPR until AED stops you. Stand back, stand clear. So remain your 360 is completely clear and no one else is touching. This is where you need to watch out for little children, parents or any other bystanders that may try and help.
Stay clear of the patient.
Having your hands up, make sure everyone is actually clear. When you're shocking, place your finger on the button, but always look down the body to make sure no one is touching. Then say shocking, shocking.
Shock delivered. Start CPR.
the beats of the AED, that's going to keep you in rhythm. You also can look at the lights that are on the AED. Yeah, 30. You're going to do your 30 compressions to 2 breaths. You're going to do this for 2 minutes. If you're working in 2, you'll be doing 30 compressions for 2 breaths each and having turns. So the person that's doing the 30 compressions will do the 2 breaths. The other person will have their hands already on the chest, ready to go. Good.
Analyzing heart rhythm. Do not touch
And
the
back,
patient.
stand clear.
No shock advised.
Let's now come to no shock advice. There can be 2 reasons. The heart has no electrical current or the patient has not regained breathing. So the way we check, so head tilt, chin lift, we're going to look, listen, feel. He's breathing, so we're going to roll him over into the recovery position, leave the pads on and just turn the AED off. Thank you for coming, and I hope you learned something today.